How safe is neurofeedback? I'm Dr. Trish Leigh. That's a great question. I'm going to answer it for you. Neurofeedback has been scientifically proven to be incredibly safe. It is much safer than taking or experimenting with a prescription medication that you don't know how your system will respond to it. So what the science shows is that there's no real side effects like you would have with medication, but for some people they can have an adverse reaction. But I want you to think about this logically because it hardly ever happens. Science proves that it very rarely happens. But if it does, it's because neurofeedback is brain training. It's basically a workout for your brain. So the way that I help people think about it is if you've never worked out before and then today you go do a workout, it's likely that you're going to feel it in the muscles that you worked out. So your brain is the muscle that we're working out in neurofeedback. So the adverse reactions that you may experience would be fatigue because you work that muscle and now that muscle is tired. Sometimes people get a headache. That's very rare. But again, if you work the muscle hard, then you might be tired and your muscle might ache a little bit. So usually that is because there has been a significant change in the brain performance pattern in the first session. But if you're working with a qualified professional, they should be able to, first of all, prevent that if they've set the training protocol appropriately so that you're being gently guided in the right direction. But if it happens to you, there's ways that the brain can basically be massaged so that that headache will go away. Rest typically makes it go away, but that training protocol can be changed so that you get a more gentle training the next time. So typically it tends to be fatigue or possibly a little bit of a headache. But again, if you have time for neuro integration after your session, then you will be able to take a rest and your brain will be able to shift its performance mode and you won't experience any of those adverse reactions. What happens very infrequently is that there's a concept called retracing. So again, this usually happens if there's a significant amount of training in the session. What happens is the brain goes, woohoo, I'm not used to performing in this way. I'm used to performing in that anxiety and ADHD mode. I need to get back there to that mode that I've been using. And retracing is the nervous system tries extra hard to get back to where it was before the training session. And in that case, a person may experience some of the symptoms that they had before directly after the session. But again, that happens so infrequently. I don't even like making a video about it because I don't want you to think you're going to be tired, you're going to get a headache, or you're going to have retracing because that hardly happens. Let me tell you what usually happens after a neurofeedback session. It is called the clean windshield effect. It is like you just had your windshield cleaned, so things are clearer, calmer, refreshed. So typically you feel less anxiety, less stress, more focused, a little bit more dialed in. And then the way that neurofeedback works is with repetitive sessions, your brain starts using that optimal performance mode of calm focus more and more and more during the sessions, and it sticks. And it becomes your operating mode outside of the sessions. And then you go use a calmer and more focused brain, which is reinforcing that new pattern and letting the weeds grow over that old pattern so that now the calm and focused pattern becomes your new operating mode forever, because the science also shows that regression is not likely if this positive feedback loop is instilled. Okay, so those are the highly unlikely side effects or adverse reactions, and the more likely, totally awesome calm focus that you'll get out of neurofeedback. I hope that answers your question, and remember, control your brain or it'll control you.